We've got a rabbit in this cage, but what we're going to do is demonstrate what would be the correct setup for a rat. We would have a bottle similar to this, maybe a little smaller for water. That way they have a little ball in the tube to drink out of. And then we would also have a couple bowls of different types of food. Maybe some pellets, and then we could also add some fruits and vegetables, making sure that they're not raw. And then we also want to make sure that we monitor how much they eat, because they can overfeed themselves, and that would lead to them being overweight, which we do not want. You want to feed approximately 5 grams of food per 100 grams of body weight. So you can kind of just monitor. Instead of the hay at the bottom, we would have maybe some newspaper, or they have kind of some almost foamy type feeling bedding that they have for rats that you can use. That way they don't have any inhalant problems from the any wood chips, or have the opportunity to potentially scratch their eye or something of that nature. As far as enrichment and kind of general housekeeping, you'd want to make sure that they were kept away from predators. So something like a cat or anything, you would definitely want to keep them as far away from that as possible, just to keep their stress level down. And then you would also, what you could do is add some toys in. Now you want to make sure that the toys are non-toxic and not coated with a plastic. You don't want any paint on them, but making sure that they're something that if they were to chew on or something, it would not hurt them. And as far as identification goes, there's many ways. In large groups, we could use cage cards, put them in cages here, or if they were smaller, identify them by their markings, by tags. You can put tags, you can do microchips, and you can also do different types of, especially for rats and mice, you can do different types of toe amputations to mark which mouse or rat is which, and then from there you can go ahead and make sure you keep track in the chart of different things that may affect those, or different things that the rat has, in order to identify the correct rat if you were to administer any type of medication or have to do anything with the rat. So we're going to go ahead and demonstrate some recognition and restraint on this rat. I've got my latex gloves on. He's fairly docile. If he were to be aggressive or something, we would want to use a towel or mesh gloves. That way we're protected and we don't get bit. So I'm going to demonstrate one technique of holding. You can either grab them at the base of the tail, or you can take kind of your 2 fingers and hold their head just like that, kind of between your 2, and then you've got the tail down here, so you've got control of the head with your fingers up here, and then you kind of have the bottom end down here so he doesn't kind of wiggle himself loose. Alright, so we're going to go ahead and give a subcutaneous injection to this rat here. I have my restrainer holding him very carefully. And what I'm going to do is I'm going to go kind of up here towards, a little bit up towards the shoulder blades, kind of pinch up a tint of skin, go ahead and give the injection, pull the plunger back a little bit to make sure that we don't have any air or anything, and then go ahead and inject. I was also checking for blood when I pulled back on the plunger, so, but it was a little chilly, so he didn't care for it too much. Oral medication to this rat right here. What we're going to do is I have my restrainer holding him. I'm going to go behind the incisors. And there's a little gap right there. We're just going to give it a little bit at a time so that he has enough time to swallow. Is that good? Come here, almost done. Almost done. There you go. And I kind of gave it slow because I didn't want him to aspirate anything because then we would have a big problem with pneumonia or any kind of upper respiratory problem. Attempt to get some blood from the tail of this mouse. So I'm just going to scrub a little bit with alcohol. And I'm holding off while I have my restrainer holding him. And so what we're going to do is, this is a 27 gauge needle. We're going to go right in there. Hold on, Betty, hold on. No, hold on. And we're just trying to get a little bit.
You probably need to.
Okay, and we're gonna stop there. Husbandry for mice is quite similar to that of rats. You want to make sure that they have an appropriate living space. Whenever they're brought into the vet, you want to make sure that you bring them in their cage. Instead of having straw at the bottom, you probably want to use something like some corn cob sheddings or just hardwood. Definitely no wood shavings. They have the opportunity to get upper respiratory infections and things like that. Identification is also going to be the same as far as toe amputations, different types of ear tags, microchipping, and also just by, if it's that you have pet rats, you can also identify them by markings. So that's something that can be used as well. Definitely want to always make sure you wear latex gloves if you have to handle the mouse. With the aggressive ones, you'll want to make sure you have some type of leather or maybe some mesh chain gloves. That way you don't get injured yourself. You can either scoop them up by the base of the tail, being careful not to grab them by the end of the tail because that can slough off, and then you have a degloving injury. Or you can grab them by the scruff of the neck, or you can wrap your fingers around their body and hold them nice and tight, just so they can't wiggle away, and also so that they don't bite you, or whoever is helping with any type of administration medication. Same thing with the toys. You want to make sure that they're non-toxic, no paint or something plastic that they can chew off and possibly ingest. Making sure that it's clear of all of that. Metal dishes typically are recommended, and you want to make sure that they do have toys, just so that they have some type of entertainment, something to keep them occupied. And then as far as feeding and watering goes, again, you'll want to have one of these little containers right here that's got the little ball, so that they have the opportunity to get some water from that. And then you'll just want to make sure that they have food. For mice, you want to make sure that they are receiving food on a restricted basis again, so that they do not become overweight. And they can have pellets, dry pellets, and then they can also have a small percentage, about 30% of their diet can be vegetables or fruits. Make sure that they're thoroughly washed, and make sure that they're not brown. Okay. We are going to restrain this mouse in here. He is pretty aggressive. So I've got a towel here, and I have my latex gloves on. I'm going to go ahead and open this, and then I'm going to try to open this carefully so he doesn't pop out on me. And then I'm going to take this towel, and I've got him here. So I'm going to kind of grab him by the base of the tail. And then you can tell by looking here that he is in fact a female, or she is in fact a female. And what we can do is I'm going to kind of try to flip her around so that her head can be exposed, but I also don't want to have her, run off. But from here, what we can do is we can do anything back here. We can do an IP injection here, or holding the tail and kind of moving the towel. We can take a look at her face there. I'm going to try to flip her upside down, but like I said, she's not very happy about this situation, so I'm going to go ahead and take her like this, flip her over on her back using my fingers to hold her head. And then I can expose her belly like that, so that we've got this here, and we can examine her kind of in this manner, but in the towel definitely, just because she is aggressive and will bite. I'm going to go ahead and do a sub-Q injection. I've got her scruffed kind of in between my fingers, and then I've also got her restrained down here. So what I'm going to do is I'm going to take this needle, go ahead and insert it in to the tent, pull back, make sure I don't have any blood or air, and go ahead and that's it. Okay, we're going to go ahead and do an oral medication administration. We're going to go kind of between there, and then we're just going to go ahead and go there, make sure she swallows it, and we are good to go. Okay, so reproduction, this is obviously a female. Their gestation period is about 19 to 21 days, so it's not very long, and they usually have sizable litters. And then what we are going to do here now is we're going to start with giving an IP injection. It's helpful to hold them kind of in this manner, just because we want to make sure that what it does is it kind of takes all of the important organs and everything, and it kind of drops them down. So I've got an itty bitty needle. Okay. We're going to go ahead and do an IP injection. I've got an assistant here helping me restrain the feet, because she definitely will kick. So I'm going to go ahead and I'm going to take the needle bevel up, and I'm just going to very gently insert just a little bit. I'm going to pull back to make sure I don't have any blood or anything. And I'm going to go ahead and administer right into there. And that's our IP injection. Moving on to a sub-Q injection. I'm going to go ahead and flip her over. The bunny rabbit, we've got this type of water bottle, and then he's kind of hanging out in some straw, which is fine. There's a kind of a basket over there for some hay, if you wanted to nibble on some, and then we've got a little metal bowl in there with some pellets in it. Want to make sure this stays, pretty clean. And this is, kind of, spacious enough to where he can kind of get around, and kind of just keeping an eye on him. I like to stay in cool, dark places, so making sure that their environment is such that they stay in that type of environment is definitely important. All right, so this is Thumper. He's kind of an older bunny, very sweet and pretty docile. Some of the handling techniques that we can use, you can scruff them kind of behind the neck. He's a pretty nice bunny, so we can kind of, whatever we need to do, kind of just manage his head so that he doesn't have the opportunity to bite somebody. You also want to make sure that we have, a good handle on the back feet as well. So if I'm going to be taking him anywhere, I want to make sure that I've got his feet in between my hands, kind of like this. Again, so that they are very powerful, so I don't want him to be, hop out of my arms and onto the floor and injure himself. So restraining the feet is definitely a big part of it. As far as another thing that you can do is you can put them on their back. A lot of bunnies like to be on their back, and kind of have their belly rubbed kind of like this. Not necessarily a restraint technique, but it is something that they can enjoy. As far as sexing, obviously the males are going to have they have a little bit more to their anatomy down here. Females have just a little slit at the opening. These guys, you can actually extrude a penis, and that's how you can tell the difference. This guy is neutered, but if he wasn't, he would have testicles as well. And they obviously are bunnies. They reproduce a lot, and they usually have very large litters as well. All right, we're going to administer a subcutaneous injection. Another good handling and restraint technique is having their eyes closed. It helps to keep them calm, keeping them in a cool place rather than warm. I typically like that a little bit better. So I'm going to use this towel kind of as almost like a blindfold, and I'm going to kind of put him kind of in the crook of my arm right here. And then what I'm going to do is I'm going to give this injection. Under the skin. Alright, so we're going to go ahead and do this. I'm going to kind of go over the back, make a little tint. Slip, poke into the skin, pull back, make sure we don't have any air or blood. And go ahead and inject that into the skin. that's it for that.
Okay.
So from the outside.
I would wet it, that way you can see it easier.
Draw some blood from this bunny's lateral saphenous vein. I've got alcohol applied. I have my restrainer holding on to the bunny. And I'm going to try to get my needle off. So what I'm going to do is I'm going to go in through the skin. I'm going to slowly fill up a little bit. Alright, and that's going to be our sample. And that's it. Okay, so here we're going to observe Jake. She is a conure, and part of the objective data is observing before you even get the animal out of the cage, kind of seeing, you know, what state their cage is in, how they have their feathers. She seems to have, her feathers are very well intact. She seems to be, you know, very capable of crunching on some food, which she seems to be nibbling on right now. She seems bright and alert, and she seems responsive to talking. And obviously you can tell she's bright and alert because she's kind of doing a little head dance over there. And the next portion of that would be kind of doing a kind of a little bit of a physical exam, making sure that everything looks okay. But we want to start with, you know, seeing how they are before we get them out of the cage. That way, one, we have a good idea of how they're going to respond when we pick them up, and two, there's a lot that we can learn from them just by looking at them and seeing how they interact in their regular cage, which is what we ask owners to bring them in when they do bring in their birds, that they bring in their normal cage, so that there's not a lot that changes, since birds are very sensitive to stress. So we want to try to keep the stress that they go through with any type of procedure that we're going to do to a minimum. Alright, so this is kind of our restraint technique. We've got a towel here for her to chew on so that she can't chew my hand. We've got the making sure not to put any pressure on her keel. However, I do have pressure on the back, her back wings, just a little bit, just to make sure that she can't fly away. And I also have a hold of her feet so that she can't try to wiggle out. This is really the best way to restrain a bird. You want to make sure that you don't use your hands, because then you or gloves, to restrain them as such, just because it can make them fearful of hands, so that's why we use a towel or gloves to handle the birds. So objectively, kind of taking a look at her up close. I'm gonna have my restrainer kind of take over.
Okay.
And she's going to hold on to her. Her eyes look bright. There doesn't appear to be any cloudiness in either one of them. Her beak looks, perfectly fine. There's no overgrowth of the beak, so she's, doing that very well. She seems to be grooming herself very well. Also, her abdomen is tucked in very well, so that, we know she's not eating too much. And she doesn't need a nail trim. Her claws are just a little bit long. We want the toes to be even with the end of the claw. But as far as everything else, she looks good. And then later we would go into a more in-depth physical exam where the doctor would, auscultate the lungs and the heart and everything, and then, feel everything in the abdomen, make sure that everything's good there, and then we would move on from there. Alright, so we're going to go ahead and do the nail trim. I'm going to grab this foot right here. There's a kind of a little line, so what I'm going to do is I'm just going to, of course with black nails, I'm going to take just a smidgen off at a time. Hold on, baby. Alright, so that one's good. We'll move on. I know, you're getting upset. That one's good there. Just going to take a little bit off of this one here. I'm just looking to make sure that there's no quicks. That one's good right there. So we're going to swap feet. She's going to hold on to the other one, and I'm going to take this one over. Almost done, baby. Almost done. We're halfway there. Okay, that one's good. Oh, hold on. One last toe, and then she'll be all set, and then we'll put her back in her cage. My quick trigger, so I'm going to take a little bit of this quick stop, and I'm going to just put it on here.
You can't push it out. It's packed in there.
So I'm going to go ahead and make sure to stop the bleeding. And we'll pack it in. And then she's all good, and then we'll go ahead and let her go relax in her cage.